I don't know if you guys saw this. I don't know if you guys read the report. It's not necessary to read the report to see the problem with it. This is a type of situation where you don't really need to be an expert to understand what the problem is, because sometimes, if you're an astrophysicist or a atomic engineer or something of that sort, and you're working at, I don't know, some facility like let's say like an atomic power plant. I'm sure if we were talking about like all the dials and numbers coming up on the screens, that you're going to have a certain amount of expertise to analyze that. But if you pass that atomic energy plant and it's on fire, you don't need to be an expert to know that that's a problem. And in this instance, if the administration is creating fake reports, literally fake medical reports that did not ever exist, in order to justify Make America Healthy Again policies, which is what they're calling this report, the Make America Healthy Again, MAHA is the abbreviation. Not as fun to say as MAGA. I don't think it's going to catch on. But the report just completely fabricated scientific studies to back up their policy implementation. This is while RFK is recommending that pregnant women don't get the C-19 shot. They're recommending children don't get the C-19 shot, even though many medical institutions are saying, wait, pregnant women actually might be a group you would want to get the shot. But RFK is up there saying we're going to discover what causes autism by September, which, by the way, 2 months away, or if we're going to be generous, the end of September. I'll give him till the end of September to figure out what causes autism. I mean, this is somebody that I would not trust with creating a report. So it doesn't surprise me that they had to create fake reports in order to back up this report. But the way that they got these fake reports is even sillier than can be imagined. Let's read a little bit. President Donald Trump and Health and Human Services Secretary Robert F. Kennedy Jr. have released the first report authored by the so-called Make America Healthy Again Commission, and it's riddled with citation errors and even outright fake research. The Maha Report, Make Our Children Healthy Again, which was released earlier this month, purports to expose the stark reality of American children's declining health, backed by compelling data and long-term trends. While the report does attempt to address critical issues and questions related to children's health, including nutrition and the effects of childhood exposure to digital devices, at its core, the report is an attempt to backfill Kennedy's more outlandish claims about vaccinations, autism, and medications with shoddy data. According to a report today with notice, at least 7 sources, 7, cited in the Maha report do not seem to exist. In one instance, a Catherine Kayes, who was cited as an author on a study titled Changes in Mental Health and Substance Abuse Among U.S. Adolescents During the COVID-19 Pandemic, the commission used the study to bolster a claim that approximately 20 to 25% of adolescents reported anxiety symptoms and 15 to 20% reported depressive symptoms, with girls showing significantly higher rates. The provided link to the study led to an error page. The journal it was attributed to did not feature a study with that title on cited issue date, and Keynes denied ever authoring a study. The paper cited is not a real paper that I or my colleagues were involved with, Keynes told Notice. We've certainly done research on this topic, but did not publish a paper in JAM Pediatrics on this topic with that co-author or with that title. Several other researchers denied authoring studies cited in the report. Harold J. Farber was listed as the author of a study titled Overprescribing of Oral, what is a corticosteroid? I'm sorry, I hate to throw my ignorance out there. My goodness. For children with asthma, which allegedly found that about a third of mild asthma diagnoses are overprescribed oral corticosteroids. Farber denied ever writing a study with that title, and told Notice and the Maha report was presenting clearly an overgeneralization conclusion on the available research on childhood asthma. And another example, a supposed study which Notice was not able to verify actually existed, seemed to have a made-up author. The Maha report was also riddled with broken links, incorrect authors, and other erroneous attributions. Now, you might wonder, why they would just cite fake reports that didn't exist, or cite authors that didn't exist, or cite authors that could directly come out and say, I never wrote this, I have nothing to do with this, we didn't do this study. Why they would do it not once, not twice, not 3 times, not 4 times, but 7 times, on top of the failed citations, on top of the poor organization, on top of the fake authors, on top of citing authors that had nothing to do with it. You might wonder why, but I don't wonder why. I'll tell you why. I don't even think that this was necessarily purposeful. It's impossible for me to read their intentions, but I can't even necessarily say that this is RFK sitting down and maliciously writing like XYZ fake study in order to convince people of his theories. I think that while that might be the case, I think the main motivating factor here was laziness. That they couldn't find maybe some studies to back up what they were saying, or didn't want to put in the effort and the work to do it. And so what they did, and this is what I suspect, is use AI in order to figure out how to put this together quickly, simply, and just publish it out to the public as quick as possible. And the reason I suspect that is in the report, you can find references to AI code just randomly in the report. Now, unless HHS Secretary Robert F. Kennedy Jr. is trying to put in AI Easter eggs, and this is some sort of like IRL Easter egg hunt where at the end of this you become like a CIA agent, right? This is very clearly laziness spilling up and spilling out of the federal government into the ears of medical professionals that have found out that they were involved with studies that they have never been involved with. So this is pretty rank laziness. This is pretty terrible irresponsibility. This is destroying the credibility of the institution that is publishing these reports. And this is at the same time, mind you, that RFK is trying to make it so that the government reports are the only reports that people are listening to, while trying to crack down on other reports published by independent medical journals, trying to crack down on those reports and wanting to be able to review what they're putting out, i.e., they want to be the ones filtering through the information and giving the okay or the not okay to the type of reports that are being published by medical journals. And what were medical organizations that were working with the American government, trying to keep people healthy. Now, this right here is already embarrassing enough, but how do you react to something like this? How do you answer to something like this? If you're Caroline Leavitt, the answer is simple: deny and minimalize. Let me show you what a CNN journalist asked Caroline Leavitt about this.
Secretary Caroline Leavitt about this yesterday.
A notice investigation found that the Hallmark Maha Commission report that was released last week cites studies that appear to not exist. We know that because in part we reached out to some of the listed authors who said that they didn't write the studies cited. So I want to ask, does the White House have confidence that the information coming from HHS can be trusted?
Yes, we have complete confidence in Secretary Kennedy and his team at HHS. I understand there were some formatting issues with the Maha report that are being addressed, and the report will be updated, but it does not negate the substance of the report, which, as you know, is one of the most transformative health reports that has ever been released by the federal government, and is backed on good science that has never been recognized by the federal government.
It's never been recognized because it wasn't real. You could have said it was like the medical professionals from like Cherry Hill Lane had discovered that rocket fuel was actually the perfect cure for cancer. It could have been anything in there. It was fake, made up by AI, just put in there to stuff the report with citations to make it look professional, to make it look like it was authoritative. And that's not to say that literally every single thing in the report was fake. But this immediately discredits the rest of it, because if it was AI that created it, then how can I trust any of it? Because it's not being properly reviewed if you're publishing fake reports. I mean, it's not like these reports came out of nowhere. It'd be one thing if it was broken links. It's not like this would be the first time the government had published a report with a broken link in it. That, to me, isn't what matters, right? It's not even like a formatting issue where like, oh, this was like a mess, kinda. These are like small professional things that the government should do when communicating with the public, but they're not of health necessity, right? These are not something that would inspire a crisis. But if you're not only misciting reports, which is one of the other issues I haven't even brought up yet, where the reports that they did use, many of them, they would say that they back up claims that they did not back up. And the authors, not the ones we've cited so far, but other authors who were cited, who did have actual reports, their reports would be used. And then the government would say one thing with the report, and then the author would come out and say, that's not what the report shows. Actually, the data shows something different. And so when you talk about the good science that's backing it up, even if we find the real science of the real science, a certain portion of that is also being misrepresented on top of the bad formatting, on top of the broken links, on top of the fake authors, the authors that were not involved, but they said were involved, and of course, most notoriously, the absolutely fake studies. Now, if this wasn't created by AI, this would mean, and this would be more condemning in my mind, actually, if it wasn't created by AI. If it was created by AI, it's condemning in a different way. It shows laziness, it shows a lack of care, it shows irresponsibility, it shows a whole different slew of issues. But if it wasn't created by AI, it's worse. And the reason it's worse is because that would mean that somebody had to actually sit down and write out these fake studies with fake authors and the fake authors and misrepresent. So you would have to sit down and purposely write this out, which in my mind is worse than we got lazy. We thought the AI would do it quicker. We were using it to assist in the process is probably the filtered way you could put it to not look like a complete schmuck. And so this is something that the journalist actually brings forward and asks, like, was this created with AI? And listen to Caroline Levitt. She just completely dodges it. Wait, I think they asked her. I thought she asked her about whether or not it was AI. Well, it wasn't in this instance, somebody else did. And when she was asked, but I think it was this woman. I just don't think they have the clip. I think she mentions it later in the CNN report. She did ask her if it was created by AI due to the code that was found in it. And Caroline Levitt dodged the question. She wouldn't answer the question straight, either because she doesn't know and therefore cannot answer and thinks it's a possibility, which is already condemning enough, or she knows it is. She sees that the AI text has been found. She saw that the code's been found, and she'd rather not create the clip, which would be endlessly used against the Trump administration of, yes, an AI program writes our government reports. And this is at the same time we're hearing from like Dan Bongino on Fox News. He's like halfway to tears because he's complaining he's working so hard in DC. I don't know if you guys saw this.
I gave up everything for this. I mean, you know, my wife is struggling. I'm not a victim. I'm not Jim Comey. It's fine. I did this and I'm proud I did it. But if you think we're there for tea and crumpets, well, I mean, Cash is there all day. We share it. Our offices are linked. He turns on the faucet. I hear it. He's there he gets in at like 6 o'clock in the morning. He doesn't leave till 7 at night. You know, I'm in there at 7:30 in the morning. He uses the gym. I work out in my apartment. But I stare at these four walls all day in D.C., you know, by myself, divorced from my wife. Not divorced, but I mean separated, divorced. And it's hard. I mean, you know, we love each other, and it's hard to be apart.
But you're doing some great work. You're straightening out the FBI. You're moving buildings. There's a lot of change.
Okay, so first off, he is whining. He is complaining. You know, he is. You can't, like, it's one thing to, like, I wouldn't call it whining if he didn't immediately say, I'm not complaining. Like, complain, just complain. But if you complain and then deny you're complaining, you want to both complain and have sympathy, but also don't want to have the shame of asking for sympathy because, I don't know, you want to be the tough guy. Just say you miss your wife or something, man. Don't like, I miss my wife. I'm not complaining, but I miss my wife. Whatever. I would buy this more if we were not having this type of rank laziness coming out with the AI reports. But even better yet, I would maybe believe this if I didn't get reports of how he's talking about Kash Patel's there at 6 a.m. I've read the reports of Kash Patel trying to sit down and stay engaged during FBI briefs. Now, if you're the head of the FBI, as Kash Patel somehow became, you get a daily brief. You know, you're briefed and you're told about what's going on in the country, because if you're in the FBI, obviously that's a high-ranking job. You have a lot of security access and like information access you wouldn't otherwise have, because your job is to keep the country safe. Keep the country safe from terrorists, keep the country safe from all sorts of threats to the American people. And so you get a brief. Well, apparently, he's bored. He's bored. And when I say he's bored, what I mean is he is having trouble paying attention in meetings, and he can't seem to like pay attention to the point where he's questioning whether or not they should even have the daily brief. And he would actually like to move it to make maybe like a weekly brief. How about we have one brief a week? And I think that'll be enough, instead of 7 briefs a week. Being an actual government official, we have to cross the T's and dot the I's, and you have the world in your hands and the lives of everybody in this country in your hands, is a lot more difficult, is a lot more time consuming, is a lot more burdensome, and takes a lot more effort and, you know, elbow grease than going on your podcast and declaring the Democrats as enemies of America and saying we're going to lock up all our political opponents. Hell, even locking up your political opponents takes paperwork. And so I think that there might be a certain weakness of the Trump government that hasn't, I mean, we've talked about a lack of experience as an issue, but I think it's not just about a lack of experience necessarily, because if you don't even want to get the experience, if you don't care enough to garner that experience so you can improve, it's not impossible for somebody who doesn't have a lot of experience to be thrown into a job, have a trial by fire, and come out on the other side of that in 2 to 3 years as a semi-competent, you know, person to fill that role. But if you get in there and you're not doing the daily briefs, you're not paying attention, you want to make it so there's less briefs so it doesn't take up too much of your time. It seems to me that you like the podcast world much more than you like government. And you know what, Kash? You can go back there anytime you want. A big issue of this government is just pure laziness. I remember hearing that Kash Patel, how about one brief a week? And I could just hear like Al Qaeda somewhere, like, yeah, wow, yeah, one brief a week. Whoa. Yeah, just look for us one day out of the week. That sounds like a good idea.